Nurses are seeking a please explain over new Ministry of Health guidelines for the use of protective masks in managed isolation and quarantine, saying it's not clear whether they go far enough. Nurses working in MIQ had threatened to walk off the job if they didn't get better specialised masks, known as N95s, to wear when dealing with returnees, rather than simple surgical masks that are also used in isolation facilities. The new ministry protocols say N95 masks that need to be specially fitted are now recommended if 2 metres physical distance can't be maintained when dealing with a confirmed or probable case of COVID in, for example, a guest's room. Kate Weston from the Nurses Organisation says they didn't get to see the guidelines in advance, and she's not sure whether the ministry considers everyone in isolation a probable case, but they should.
We would need clarity to make sure that that definitely is happening, because reading it, it's a little bit unclear to me. So if it's unclear to me, it's probably unclear to others. So we need clarity from the ministry that our expectation is if you are working in either a managed isolation facility or a quarantine facility, that you will have access. Because the guidelines talk about those facilities where actually they have got some quarantine and some isolation. So it needs to be across all facilities that the N95s are made available.
Yeah, because if we look at the detail of the guidelines, it says N95s will be supplied when you can't keep 2 metre physical distancing, and I'm reading from the guidelines here, and also if you're dealing with a confirmed or probable case. So people returning to New Zealand who are in managed isolation rather than quarantine, in your view, people in managed isolation, are they probable cases?
You have to think that they are, and the isolation facilities exist only to protect the wider public from returnees who have come from countries where COVID is a real problem. So, in our view, in NZNO's view, those people in those facilities need to be considered as a possible or a probable case until you have proof from the consecutive tests that they are in fact negative. So to go to that higher level of PPE would be our expectation for anyone who's having that close contact, as the guideline describes, with anybody who is currently residing in a managed isolation or quarantine facility.
How many people will nurses in MIQ be interacting with, and how? Like, are they going from room to room, and on any given day could they be, passing hundreds of people?
They have numerous points of contact, and in our facilities there's anything between, say, roughly 200, 250, up to 400 people in the much larger facilities. So there's multiple opportunities to have contact for a variety of reasons with people in that space that the guidelines talk about. And not everybody presents as symptomatic with COVID, so it is possible that you may be dealing with someone who may be very mildly unwell, not unwell at all, yet still COVID positive. So these are the cases that we are wanting that higher level of protection, because we in New Zealand do still not have, this is a step in the right direction, but we still don't have the same degree of PPE protection, particularly with regard to masks, as counterparts in other countries do.
So when you say that, how does it compare? And also, for example, how does it compare? We've probably all seen the pictures of nurses at roadside testing facilities. How does the PPE in MIQ currently compare with those nurses working at testing sites and your colleagues working overseas?
Okay, so nurses working at testing sites, you'll see them with a plain surgical mask, visor, a gown and gloves. And the difference that I would like to draw there is that those testing stations, a lot of them are outdoors, a lot of them are very open, and it is a transient experience. The person is passing through and they are gone. Whereas if you are working every single day of your working life in a managed isolation or quarantine facility, that is a closed environment. A lot of those buildings are air-conditioned, and there is a significant potential of airborne spread, particularly in the quarantine facilities, because we know that everyone who's positive is sent to those. There's still a risk in those managed isolation facilities, and they are both our point of strength and what sets us apart from the rest of the world in terms of our COVID control. It's also our weakness if that border control is not optimal.
So these masks, N95s, they have to be properly fitted, and that involves a degree of training. So at the moment, is any of that training happening at MIQ?
We're aware of some people have been trained, but our expectation, as you know, is that if you are putting yourself up to work in one of these facilities, irrespective of what your role is, that part of your orientation will be being fitted, because everybody's face is different. So it needs to be fitted, and people need a degree of training, particularly if you're not a health professional, on how to safely use that mask so that you're not putting yourself inadvertently at greater risk. It hasn't happened at orientation, and the Ministry's guideline indicates that it's only going to happen over the coming weeks and months. And that to us is an unacceptable situation that needs to be addressed with urgency.
You mentioned that you're coming into the busiest time of the year. Can you explain?
Well, we're coming into Christmas and the holiday season, and we know that the facilities are apparently booked up from now until well into January. So we need to ensure that every individual coming back into the country is going to be safe, healthy, well cared for, and that all of those workers are in a position of being as well protected as possible, and that everything is held in balance, and we come into the busy holiday season with our borders secure and with no breaches.
So as it stands, you're not 100% clear on whether these new guidelines marry up with what you are wanting from the Ministry of Health. So what happens now? Please explain.
We're still going to seek some further clarification and still go back to the Ministry and say we still have an expectation that there will be universal access when people need those masks, but also importantly that people are fitted so that when they do need them, they can fit them properly and use them effectively. Because without that, we've learned lessons earlier in lockdowns where masks were poorly fitted and they were next to useless.
So you're not there yet in terms of what you're asking for.
No, we're not there yet. It's a step in the right direction. It's a good acknowledgement that there is a risk, but we want the acknowledgement of the risk is not only in the isolation quarantine facilities, but there is also a risk in the managed isolation facilities where people may or may not have COVID.
And that was Kate Weston from the Nurses Organisation.